Your brain may be begging for oxygen right now and you have absolutely no clue about it. This is what exactly happens in stroke. So what is stroke? Let's understand it in very simple language in the next 1 minute. So stroke is a medical condition involving our brain in which the blood supply to the brain is compromised. Why does it occur? It may be that the passage of the blood supply to the brain is blocked, as seen in case of ischemic variant of stroke, which may be due to high blood pressure or high cholesterol. Or it may be due to the bursting of the blood vessels reaching to the brain, which is known as the hemorrhagic variant of stroke. So the patient may present with symptoms like sudden weakness, or the facial muscles are dropping to one side, or there is slurring of speech. So the next time you see someone with these symptoms, don't ignore it like you ignore your textbooks and rush them to the hospital for early diagnosis, because it is very important to diagnose that patient as early as possible. So in the hospital, we perform CT to rule out bleeding and an MRI to pinpoint the exact location of the stroke. So in the hospital, for the management of the patient, we give a tissue plasminogen activator in case of ischemic stroke within 4.5 hours to control the stroke. And in case of hemorrhagic, we control the bleeding, we maintain the BP and proceed to surgery. But that's not your headache. That's what the doctors would perform in the hospital. What you should keep in mind is that how to prevent stroke. Stroke can be prevented by following these simple lifestyle modifications. You need to keep your blood sugar in check. You need to control your blood pressure. You need to quit smoking if you are doing that. So now you know everything you need to know about stroke, or at least everything you need to know to save a life. So the next time you see someone having those symptoms, you rush them to the hospital, because you save a brain, you save a life.